My friends, this is Dr. B, the best doctor in medicine and the most handsome doctor in medicine. 30 plus years of clinical experience at high level in medicine. Never forget that Dr. B genuinely loves you and genuinely cares about you. Today, Dr. B wants to tell you about why me, Dr. B, I take such a high dose, the highest dose possible of vitamin D every day. Please remember that the medical guidelines tell you from the American Medical Association that you need to take, if you are 50 years old or above, 50 or above, you need to take between 2,000 and 4,000 international units of vitamin D every day as a supplement, right? 2,000 to 4,000 international units I use per day, right? Dr. B, I take 10,000 per day of vitamin D. I take 10,000 IUs per day. 5,000 I use in the morning, 5,000 in the afternoon, which means that I take 2.5 times the upper maximum limit that is recommended. All the studies have proven that you do not want to go beyond 10,000 international units per day. This is the maximum allowed dosage. Otherwise, if you go higher than this, you're going to develop vitamin D toxicity. Means the calcium in your blood is going to go too high, and it's going to cause damage to all your organs, especially the kidney, and you're going to develop kidney stones, nephrocalcinosis, and blah, blah, blah. So always stay with the dosage of 2,000 to 4,000 IU, but I want to explain to you why I go to 10,000 IU, which is the very, very maximum possible dosage, beyond which you will develop vitamin D toxicity. The reason for this is that Dr. B wants to benefit from one of the other major properties of the vitamin D, which is that it boosts your immune system. The number one property of vitamin D is that it allows the absorption of calcium from your intestine into your blood. If you eat calcium, whether supplement or dairy or whatever it is, but you don't have vitamin D, your intestine is not going to absorb that calcium, right? But what a lot of doctors do not tell you is that the second major property of vitamin D is that it is an immune system booster. Dr. B, 50 years young, I have never, ever been sick in my life. Never got the flu, never got the rhinovirus, never got the COVID, never got any bacterial infection, never got any STDs, nothing. I have never taken even one day off work because I was sick. And I swear to God, I swear to the life of all my family members, never taken even one day off work because in the morning I got sick with fever and blah blah. It just never happens. I'm at work every day, 365 days a year, from Monday to Saturday included, 8 to 10 hours a day, except of course Christmas holiday and blah blah blah, right? When our clinic or hospitals and blah blah blah, some of them are closed, right, during Christmas, blah blah blah. Anyways, you get the point. So 10,000 IU, right? I do it, and I make sure, in order to make sure that I'm not developing vitamin D toxicity every 6 months, I check when I do my regular blood test, my vitamin D level. The vitamin D level should fall between 20 and 70 nanogram per milliliter. 20 and 70. Mine is around 70, 75 all the time. So I'm at the higher level of the normal range. So I'm doing good. In addition to that, because I'm a medical imaging expert, every month I check my kidneys to make sure that I'm not developing even a tiny, tiny, tiny kidney stone, right? My eyes can detect very easily even a few millimeter kidney stone, right? With the high resolution machines we have. But you don't have access, like Dr. B, to be able to do your own ultrasound, right? Every month, right? So it is very important that you discuss with your doctor and you tell your doctor, listen, would you be able to increase my dosage of vitamin D from, for instance, 2,000 to 4,000 or from 4,000 to 6,000 and then slowly go higher and higher while your doctor checks regularly every 3 months or 4 months or 5 months your vitamin D level, right? And make sure that you do not take too much calcium, right? When I take my calcium supplement, pay attention to this 600 milligram, right? You see the 600 milligram, right? I don't take the whole capsule. I take only half of it. Half of it, 300 milligram per day, right? 300 milligram per day of calcium with the huge amount of vitamin D that I take, it absorbs the whole calcium. My blood calcium level is absolutely optimal. My vitamin D level is absolutely optimal. And because I'm taking this huge dosage of vitamin D, not only my calcium level in my blood is normal, my bones get strong. In addition, I benefit from the immune system boosting properties of vitamin D. Like this, you will be strong and healthy like Dr. B. You will never catch these nasty bugs, flu, rhinovirus, coronavirus, all these infections and blah, 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 pneumonia. Never had any of these freaking diseases, right? In addition, obviously, you need to exercise, sleep good, zip your mouth and stop eating junk food, blah, 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 blah. But again, I repeat, do not do it yourself. You have to coordinate this with your family doctor. And remember, most family doctors have absolutely no catch or clue that the second major property of vitamin D is a very, very powerful booster of your immune system. So why would you not take advantage of this beautiful vitamin D that can boost your immune system and keeps you healthy? Again, remember, boosting your immune system doesn't come only with vitamin D. You need to not have diabetes. You need to sleep good. Sleep is very important to boost your immune system. Healthy diet, healthy antioxidants, vitamins, minerals, blood. It's a combination of everything. And remember, get rid of that diabetes and pre-diabetes. There is nothing worse for your immune system than having pre-diabetes and diabetes. So you need to get rid of it. Then you ask your family doctor, listen, Dr. B, the best doctor and the most handsome doctor online, is claiming that one of the major second properties of vitamin D is to boost your immune system. Can you please increase my dosage of vitamin D? So if you are at 2,000, ask him to jump you at 4,000. Do a blood test in 3 months, checking for your calcium level and phosphate and vitamin D. Make sure they are in normal range. Keep going, and then in another 6 months, from 4,000 go to 6,000, blah, blah, blah. But at the end, never, ever, ever go beyond 10,000 units per day, no matter what. And make sure that every 6 months, your doctor sends you to a beautiful imaging department like Dr. B's, whether it's a private department or hospital, to do an ultrasound of your kidneys. It takes 5 minutes. For an expert like Dr. B takes 2 minutes. In 1 minute, I look at this kidney and I can tell you you don't have any kidney stones or nephrocalcinosis. Another minute, I look at your other kidney and I tell you don't have any stones and you don't have any nephrocalcinosis. I send the report to your doctor and I see you in 6 months. So remember, do not make that decision by yourself to increase your dosage of your vitamin D. You need to follow the prescription of your doctor. But you can double that dosage and then again, blah, 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 slowly over time. There is no rush. Slowly over time, you can reach maybe 6,000, maybe 8,000 per day, maybe like Dr. B, 10,000 per day. Everybody's different. You might not tolerate 6,000. You might not tolerate 8,000. You might not tolerate 10,000 international units of vitamin D per day because everybody is different. That's why you need to coordinate this with your doctor to check your blood test, to do a blood test to check your calcium phosphate, vitamin D level, and an ultrasound. I love you guys. Dr. B loves you genuinely, regardless of your gender, ethnicity, color of your race, sexual orientation, whether you're a man, a woman, anything in between, religion, Muslim, atheist, Buddhist, Jew, Hinduist, Christian. I don't give a catso whether you're black woman, black man, Asian. I love you because I love medicine and I love people. Put any question you have down there. I promise I will get back to you. It doesn't matter. I don't give a catso whether you criticize me or love me. Put your comment down there. I promise I will get back to you. If you have any question, I promise in my beautiful but busy life, I will get back to you. Kopkunna krap, sawadee krap, as they say in Thai. I will talk to you in the next video. Bye-bye.